Welcome to The Voice of Nursing, brought to you by ICG Medical. This interview is with Judith, who is currently located in the UK, and we're so excited to have you here. Thank you for joining us. How are you doing today?
Fine, thank you. Yeah,
That's good.
fine.
That's good. All right, Judith. So let's get into it. I know that we had a bit of a discussion beforehand, but Judith, your journey from Nigeria to the Philippines and eventually to the UK is quite unique. Could you share what motivated you to pursue nursing qualification in the Philippines, and how has this decision sort of impacted your career?
Right. Well, it wasn't a decision I made before I started nursing. It was what I made on the journey of nursing. So, like I said before, I I did my nursing in Nigeria, and that was a 3-year program. I did my nursing in School of Nursing in Nigeria. So I got my diploma, but I needed to get my degree. And before I can get my degree in Nigeria, I have to go to the university for 4 years. So me calculating it, I was like, this is so much amount of years to spend studying nursing. I needed to get my degree ASAP. So I was already working, and then I spoke with one of my friends. She was already in the Philippines. Then she told me that she studied in the Philippines. She's doing nursing. That I had to get the information that I can do my nursing for a year and 6 months to get my degree, since I already had a diploma in nursing in Nigeria. So then I told my parents, and they were happy with it. So she helped me to get a form in the Philippines, and I never knew about the Philippines. I've never just done my friend, and I've never seen any Filipino at all. But I didn't know much of the country, but I just had to Google, and it was a nice country to live in. So I bought a form and I got the admission. Then the admission process it wasn't tedious. And also the embassy process also was not so tedious as well. So I got my visa and I traveled. So I spent a year and 6 months in the Philippines from 2016 till 2018 December, and I came back with my degree. So that was it. So the inspiration was just that I noticed that I could do my nursing in a shorter amount of years. So I don't need to spend so much years studying, doing my degree, because I needed to also do my master's and my PhD. And if I spend that for 4 years getting my degree, it's going to take a while before I can do the other one. So that was it. And when I got to the Philippines, it was a whole new level. I enjoyed the program in the Philippines. I enjoyed the Filipinos. I had lovely fun in the Philippines. So it was a life-changing decision, because that bridged the gap that I would have used to do other things. It bridged the gap that I would have, it cut the time short. So I didn't have to spend much time studying for my degree. It had to reduce it by more than half. Like I wanted to spend like 4 years in Nigeria, but then I spent like a year and 6 months, which has also reduced it. I made my aspirations. It made me move into another level in nursing. It has impacted me so much, because I'm no longer thinking of getting my degree. I already had my degree. I had not had to use that amount of years I would have spent to also think of other things to do also as a nurse.
Oh, wow. And tell me, before we move on, why would you have had to sort of restudy and go back for another 4 years? Is there sort of like a difference in the type of nursing that you study?
No, no. So there are two ways you can be a nurse in Nigeria. So it's either you go through a school of nursing, so where you get your registered nurse certificate, that they can call it a diploma in nursing, or you can go through the university, so you can get your degree and the registered nurse certificate. So the registered nurse certificate, you go into a school, but it's mostly practical. So you're going to the school, you're not going to a university proper. So it's just a school whereby you're taught just the basic nursing and the practical terms of nursing. So then you're not given a degree certificate as you would get when you go to a university. Given a registered nurse certificate, a diploma it is. So before you can get a degree will help you to, do your master's. You can't do your master's without a degree. No, you can't get to certain positions without a degree. You have to get a degree before you can think of doing a master's, before you can think of doing a diploma, before you can think of advancing or doing other post nursing certificates or courses. So you have to get a degree. So that was what motivated me. I needed to do all those things. I needed to advance more in my nursing career. I don't want to stick to just my registered nurse certificate. I needed so much more. So that was it. So it's just something that is another step that we just have to take. So people go through the university after that, but then it was a long time, so I don't want to spend so much in the university. So that was why.
Well, I must say you really took a very good approach. But tell me, many would say that transitioning from your nursing education to working in a surgical unit in the UK can be challenging. What were some of the most significant adjustments you had to make, both professionally and personally?
Well, yeah, it was very challenging when I first came here. But I came here working in a gastro unit first before I moved to a surgical unit. So that was quite challenging because in the area I worked in Nigeria was a general unit. It was a general nursing. So I worked where I have to care for patients with different symptoms. It's not like specialty centered. So coming to the UK, I started working first as a gastro nurse. So you had to do with CPS. So that was the most challenging. So I think that made me get used to nursing in the UK before I now transitioned to working in a surgical setting. So working in a surgical setting, I had to get to know so many equipment that I never used in Nigeria. So that was another challenging part. The equipment, I also had to meet people that I don't understand their accent sometimes, our accent in Nigeria, yes, we speak English, but it's a different kind of accent here in the British world. So I had to open my ears to listen. So I think there was a barrier in that, because then my matron, she would talk so fast. So I really had to make sure that I keep on telling her, please repeat so I can be able to understand. So that was another challenging. Another thing is equipment. There are some equipment that we use here that we don't use in Nigeria. That was it. So I really had to stoop so low to learn. I went through supernumerary period before I started working as a nurse proper. Then I went through people to teach me. I constantly developed myself by learning, by going through textbooks to understand things, and also to keep myself abreast of the recent procedures and policies in nursing, especially the surgical setting. I also had to do so many researches, and I used my seniors in the field in at workplace to be able to understand more of what is going on. So it was challenging, but with the help of people around me, I was able to conquer all the challenges I got. And they were all lovely people I met in the surgical unit. They were so willing to teach you. They were so willing to render their help to you when you don't know much. So it was during that first few years of my surgical nursing, was just learning and relearning. So yeah.
So, yeah, you've mentioned that you've worked in surgical unit, and I'm assuming that a lot of those patients experience anxiety and require a lot of emotional support. And how do you what's your approach providing emotional support to patients in that setting?
Right. So emotional support is a key. Like emotional distress can help people, can reduce the life expectancy of people. When patients are distressed emotionally, it can reduce the healing time, to reduce it by half. Sometimes it can also reduce it drastically. People can die from being emotionally distressed. So emotional support is something I found to be very helpful to patients. And I've noticed that patients in the surgical unit, they are all filled with emotions. They are filled with emotions. They are filled with fears, anxiety, because they don't know what the outcome might be. They don't know how people are going to accept them. They don't know, especially the kind of surgery the person is going for. It's a surgery that requires a loss of a limb. So it comes with so many things. You're worrying about how people will take you when you come back from surgery, how your loss of a particular body part will make you feel, and how you're not going to be accepted. So is something that happens every day. So what I do is, I first of all try to understand this particular patient, because patients are different and the way they present emotionally can also be different as well. So I try to understand that patient. I try to understand them. I try to get to know them very well. Then another thing is, I also try to, relay their anxiety by allowing them to talk about their fears, their concerns, their worries, and listening to them. So listening skill is something that you have to know very well as a nurse, because you need to allow patients to talk and you have to listen. So when I allow patients to talk, it enables me to get insights about their worries, about what can be the cause of their worrying and also their concerns. So that is it. So if I know all these things, it enables me to work very well, to be able to know how to counter them. Then I start giving them support, advices. I'll start suggesting what they want me to do for them. Do you want your family around? Because sometimes family can also be a support system, a strong support system that patients can need.
Mm,
So
yeah.
I wonder if you want your family around. Do you want me to call anyone? Is anybody that you can talk to, before you go for surgery or after surgery? Like, all these things can help. So I discovered that by doing all these things, I've been able to solve a patient's, reduce the patient's anxiety level down to something, maybe drop down to, if it was 5 before, down to 4. So, and I also let them rate how anxious they are. So by rating, I get to know the level of that anxiety and whether their anxious level is high or low. So that is one of the ways I am able to counter that. By doing all those things, most patients, they feel happy while living, and prognoses are also good as well.
Yeah. And I suppose it's also about being their friend and really making sure that you feel like, or they feel like you care for them and they're willing to
Yeah.
actually just be very honest and open with you. And tell me, what inspired you to become a skilled emotional support or what sort of inspired you to skill yourself to become an emotional support for patients? And how is that skill enhancing your nursing practice and patient care right now?
Well, I would say it's the patients. Yeah, patients inspired me. Like, if you're to get to see patients every day, they come and their cries, their worries. Oh my God, you really need to do something to help, because their cries, their tears signifies help. So it was that help that I needed. I saw, and I looked at them. I looked at some of the patients, and I noticed that they really need something, and that is the emotional support that we need to, it goes beyond medication. There are so many things that medication cannot cure very well. There are things that our talk and our cares can do well than medications. So that is it. So that was my inspiration. My inspiration was the patients I see every day, and you know and also seeing that when you provide this kind of care, they go home happy, and they go home saying thank you to you. And whenever you see them, they are laughing. That is my inspiration. So I get inspired when I do some of those things and get results. So I would say patience is my biggest source of inspiration. And also, I've also, in the past, there was a time when I first started. I met a patient. So she narrated a lot of things and how she was emotionally abused by her partner and everything. That's I didn't get to hear that early. I came in and she was crying after a surgery, so I thought she was in pain. Like, I kept on, I gave her pain medication because I thought that was the pain was just attributed to that. But after that, it didn't help her at all. So it was, I think, 2 days after the surgery, then she was still the same. There's no difference. Then I went to her to a room, to just do some set of ups. Then I started talking to her, and she started narrating everything, and I cried. I cried because I would have done something earlier. Maybe if I had gone to her before the surgery, or maybe on the first day I saw her, maybe it would have been something different. I thought that was my biggest inspirator. Like, I was inspired by that particular patient, because there's a lot of things that I would have done that I did later. It didn't do much. So I did it later, and I would have done it in the beginning. It would have helped that patient a lot, because so many patients are mentally unstable because of their emotions. So many patients are filled with fears. So many patients are dead from a surgical treatment because of their emotions and anxiety. So we really need to take take our patients' emotions make it very important in taking care of patients.
Mm-hmm. And tell me, Judith, as a nurse with international experience, having worked in the Philippines and also Nigeria and now in the UK, some of the cultural considerations or differences you've specifically encountered in providing that emotional support to patients with perhaps even diverse backgrounds?
Yeah. I've encountered so many cultural things. In fact, there are so many cultural considerations I've also tried to, introduce. I've noticed that there are here in the UK, there are Chinese, we've got people from the Asian community, we've got people blacks, we've got so many people from different religions, from different cultural backgrounds. So it's very important that we put that into perspective while providing emotional support. Like some people are Muslims, not everyone is a Christian. So when you are providing emotional support, you need to bear that into consideration. Think of their beliefs. You need to ask them what they want. Do they want any priest or maybe their imams to come into them and talk to them? This can be a very crucial moment for people, and they really need people of that high caliber in their community to come and talk to them. Some people would just prefer, oh, I want my pastor to come over and talk to me. I think my pastor will be better praying for me. So, but if you think that everyone is the same and you offer a pastor to come and pray for a Muslim, that was a red flag, and that Muslim will not take it lightly with you. So we really need to consider all those things. For Chinese people, they really believe in their acupuncture. So you need to also think of that one. So many people also believe that meditation is also a way of relieving stress, emotional distress. So you need to think of that. Some people have cultural beliefs and practices, and we need to think about all those cultural beliefs. And how do we know that a patient it has this particular cultural belief? Is by getting to know them. So on first encounter is one of the things we ask. That's why one of the questions we ask patient is, what is your religion? So by asking them that, is there any cultural belief? We ask them all those things. By asking them that, you get to know more about them and they tell you. So if you don't ask them, you won't know. It's just like offering a Jehovah Witness blood transfusion. That is the same way, because if we don't know, if you offer them all those things, is going a long way to jeopardize their faith, and they might sue you for that. So cultural background, I noticed that a lot of people have different cultural backgrounds. I'm trying to put them into perspective. People use meditation, acupuncture to take care of themselves. People need their spiritual persons, pastor, imams. So if you consider all those things, and the thing is that, and also people also some foods that people eat, some other people do not eat that. And people can be emotionally distressed if they are served a particular food. It can also increase their emotional distress. So you need to also know all those things by getting to know this person, asking them questions, telling them to explain themselves and also who they are, and also tell them what they want and what they don't want, and how they also want to be cared for.
Mm-hmm. And maybe if you can share with us and the audience a memorable story or experience where your emotional support made a significant difference in the recovery and overall experience of a patient.
All right. So, yeah, it was a particular day. It was a particular day. It was when one of my patients I think she had a road traffic accident. So that was in Nigeria. So, and they were brought to the hospital where I work, and I just graduated then. Then they were all filled, the family all came with the patient, filled with cries, worries. They didn't know the outcome of the patient's care. They didn't know how the patient was feeling. So we brought this patient to the theater for some operations. Then after that, patients came out, okay, and no, the family had to go back home. So because they thought the patient was all right. So we were with the patient, and later the patient started complaining of pain. So when I went to her, she was in great pain. Then I asked her what the matter was. Then, we thought it was just pain. So we gave her some pain medications, and without knowing that it was so much more. So she was in severe pain. And we had already told this family to go home, right? So the family later came back. No, we called the family and was like, the patient is in so much pain. And they said, oh, they've already gone, and they're not able to come back again there because they've gone to a far place. So I went to the patient, and I started talking to this patient, and I got to know that the way she can be able to cope with anxiety is by having a family around, and be able to cope with pain is one of her distraction technique, is by having her family around. So there's no way we can do something, but I had to ask her if she has any other phone number that we can call, any other person, any friends. Then she gave us a particular number, and we called this friend, and she came. So when she came and they started talking, and we noticed a difference from how this patient was to when the family came. So I think it's another way of her relieving her own fears and anxiety by having a family, a support person that she talks to. And the difference from when she was in so much pain and when the family came was a lot more. So it also made me to know that people have different ways of taking care of their emotions. To this patient, is their family, is a friend, that is the person. So that the person needs to take care of her emotions. So that was one of the things that made me to want to, I really developed interest in taking care of patients' emotions. So that was a memorable thing. When I think about all those things, sometimes we think that is the big things that matters in nursing is actually the little things that matter. To this patient, it's not even the medication, it's just the family that the patient needs to come. And just, she just needs a family to come and talk to her, and also tell her things that she enjoyed in the past. These are all she wanted. And she didn't have it with us. We were all giving her things that she never even wanted. We were giving her medications and other things that she may not want, but she wanted more. She wanted her family to be here. And it's just, it's strange because so many people want different things. So it's something that emotions can do. It's something that we've gone a long way to provide for this patient. And it's a story that I get to tell every day.
It's amazing. And I think, yeah, that really kind of shows you that there's not a lot that your courses or your degrees can sort of teach you about the nuances of everybody's
Yeah.
individuality and personality. And this sort of lends into the next question. And we know that nursing is a continuous and evolving space. So what kind of ongoing training or education have you pursued to stay updated on best practices in providing emotional support to patients?
Um, well, I've tried to improve in communication skills. So I've discovered that communication skill is a very good skill that a nurse needs to have. So if you have communication skill, you'll be able to know what to communicate to a patient. You'll be able to know how to approach a patient. You'll be able to know the things to say to a patient. So communication skills is something that I would encourage everyone that is a nurse to also looked into us, taking. We need to make sure that that you are skilled in the ways you can talk to patients. Another thing is listening skills. So I had to, learn how to, listen to patients. Listening is not just by, talking sitting and you're talking directly to patient. When you listen to with your whole mind, you'll be able to understand this patient's point of view, where this patient is coming from. If you don't listen very well, if you don't have that listening skills, you may not be able to understand what a patient says to you. So communication skills and listening skills is one of the two things a nurse should be able to learn. One of the skills a nurse should be able to learn if you want to take care of a patient's emotions. You'll be able to know what a patient is saying. Listen to the patient. When you listen, you'll be able to understand how you can be of help to this patient. So these are two things that I've learned, and I keep on developing to be able to take care of patients' emotions. And then I've also thought of, I've also done, meditations, different meditations, because when a patient is saying that it's only meditation that I can use, to take care of my fears and anxiety, you also want to practice to know how this can help as well. So I've tried, practicing that, and I can also see that meditation is also very good to help to relay a patient's anxiety as well. So that is also a skill. People do not know that meditation is also a skill. It's a skill that a nurse can also take. Besides communication and listening, meditation skills is also a skill, because when you know it, you'll be able to teach a patient, even if a patient does not know how to meditate. All right. So another thing is deep breathing. Deep breathing, you need to, because people can also relay anxiety by also doing deep breathing exercises. So it's one of the skills I've also tried to, I've also tried to know. You have to teach a patient, you can tell the patient to just do deep breathing exercises, and it can also relay a patient's anxiety. So that's one of the things I've also done. So make sure that I communicate very well in a way a patient to understand, and I make sure that I listen to a patient. Listening will make me to understand this patient and know what the patient wants, and also how I can be of help. And I also make sure that I also understand what meditation is and deep breathing exercises. For these are four things I've always tried to learn and to relearn, to learn from people, to be able to offer good advices and good help to my patients.
Mm-hmm. So, Judith, looking ahead, what are your aspirations and goals for your nursing career? And how do you plan to further contribute to the well-being of patients?
I plan to move into another level in nursing. I plan to move higher in my nursing career. I plan to do my master's in public health. That will also give me an opportunity to be able to talk to people in all communities regarding nursing. By doing the public health, by doing masters in public health, I'll be able to take care of important things in people's community. I'll be able to be a voice of the people, voice of patients. And I also think that public nursing is a good way to touch so many lives in nursing. Then I've also wanted to be a diabetic nurse. I've tried to gain admission into studying that in the past, but then I failed. But this is something I want to do. I really want to be a diabetic nurse. I don't know. I don't even know what was inspiring me to be a diabetic nurse. But inside of me, I want to be a diabetic nurse, and I've not stopped. I really want to get get to study that, and to also fulfill that aspect of me being a diabetic nurse. So I think nursing did not just stop as being a bedside nurse. There are also so many things that people can explore if you're a nurse, to be able to move higher in nursing. And for me, I intend to move higher in my career. I intend to go higher. I intend to explore ways on how I can be of a help. I intend to explore ways of how I can help patients recover fully. I intend to keep myself abreast of so many policies, evidence-based practices in nursing. I intend to know more in nursing, that to be able to help my patients to recover. So there are lots of things I really want to do as a nurse. And as day goes on, as day unfolds, I'll be able to think of them, and I'll be able to to do all those things.
That's amazing. Judith, here We also like to inspire the next generation of nurses. And my last question to you before we end is, what piece of advice would you give to an aspiring nurse?
So, for to an aspiring nurse, I would tell the nurse to just be yourself. You know what you want to do. You know what you wanted to be as a nurse before you picked up nursing. Um, Nursing is a calling. Nursing is not just what you can just decide you want to be. There must be something that drew you to being becoming a nurse. You did not just wake up to just become a nurse. So you know that, and you know where you're going. So do not just settle for less. Once you know what you want, you go for it. If you think that being in a particular country is what you want, you work towards going to that country to be and becoming a nurse that you want to be. If you aspire to be a master's degree holder in nursing, you aspire to get it. So what I believe is there is no endless possibilities to what someone can get. If you want to get anything, you struggle to get that you want to be. So if you are a nurse, I want to aspire everyone that wants to become a nurse or that is already a nurse to keep improving, to keep making sure that he or she knows more, because when you know more, you'll be able to impact more to patients. Just keep learning. A lot of people are where they are today because they are maybe at the lower level of their career because they've stopped learning. So if you keep learning, you'll be able to understand more. You'll be able to know so many new ways you can help take care of patients. So I will also encourage new nurses to keep learning. There is never learning is never enough. You keep learning, you keep understanding things, and you keep moving forward. So if there's anything that you want to do not stop until you get it. I always have this key that perseverance is the key to success, and I don't stop at something until I get it. I always try until I get what I want. Okay, so there are so many fields that in nursing, there are lots of fields in nursing. If you think that you're doing this one and you think you can do well in the other one, you strive to do well in that one. You do everything that it takes to do well in that one. Okay, so if you think that now you're not okay in this particular field that you are in nursing, and maybe you think another specialty will help you get to do what you want to do, or to render the kind of help you want to render to the patient. Aspire to get there. Aspire to get there, because when you stay there and you keep admiring people there, you can never get there until you do it. So keep practicing, keep being yourself. You know why you came into nursing, you know why you are here. Do not allow other people's negative experiences to make you fall apart. You know what you want to do, just be what you want to be. Okay, just be whoever you want to be the best of a nurse that you want to be. Do not allow so many people, negative people that have done so many bad things in nursing to affect you. So take care of patients and make sure that you keep yourself abreast of the recent policies, procedures, evidence-based practices. That's the only way we can go in nursing. So and make sure that our patients is our priority. So if you want to be a nurse, just be it. And you also make sure that the only person that you owe your number one vow to is a patient. You swore that you're going to take care of patient, and you're going to make sure that a patient is okay. So you make sure that you hold that you make that important, that every day you go to work, that your patient is your priority and nothing else should come first. Your patient should come first at work. When you go home, every other thing can come first. But while you're at work, make your patient a priority. I also want to assure new nurses that whenever you're working, just pretend as if you're being seen. So when you work as if you're being seen, you'll be able to do more, because when someone is observing you when you're doing something, you're going to work to make that perfect. So just pretend as if someone is observing you when you're working. That's what I always say. If you think someone is observing you, be able to work into perfection, be able to apply all the good procedures that you're going to apply to make something work. But if you think that people are not watching you, you might do anything that you want to do. Okay, so I always tell people to pretend someone is watching you, because that's another way, that's the trick that people can use to move higher in their nursing profession.